Good morning. It's October 22nd, 2024. I'm Dr. Duke Majan. We're broadcasting spine surgery live from Duke Spine Institute. You've joined us for a bilateral piriformis muscle release. The piriformis muscle is the third most common cause of lower back pain, typically buttock pain at the top of the buttock. And because the sciatic nerve comes out of the spine or below it, the sciatic nerve can be affected by the tear in the piriformis muscle. The tear is right where the sciatic nerve is. It's usually in the middle of the muscle belly. Now the muscle attaches from the tailbone over to the top of the hip, and the safest and easiest place to do a release is exactly right where my instrument is, right there. Yep, I'm literally right over the attachment point of the muscle, there and a little bit above. Jordan just showed you. If you have questions, feel free to ask, but this is the third most common cause of chronic back pain. The first is the disc injury, the second is facet joints, and the third is the piriformis. The fourth is the SI joint. Okay, I'm going to make my incision, and feel free to watch and ask questions.
At this moment, no current questions.
All right, why don't we show the audience the 30 causes of chronic back pain? And you'll play this, will you play this in the bottom corner or no? You cannot.
I don't think I can, no.
All right.
I can do that for next time, though, for
All right,
sure.
in that case, we'll never mind the 30 causes of chronic back pain. Let's just stay with us, and let's do the procedure, okay?
Not a problem.
Because the 30 causes will take too long. Shot. We'll just see if there's any questions. All right, perfect. So you can see the tip of my probe is sitting right at the greater trochanter. I've got to dock it right on the bone just to make sure I'm in the right spot. So this patient has had a fusion already, not by me. She had it done in Canada at L5S1. She's been in severe pain since her fusion, and her pain is coming from areas both above and below her fusion. We call it adjacent segment disease. Okay? It means that the spine segments above her fusion and below her fusion are degenerated faster as a result of the fusion, and that's causing her more pain. Now, unfortunately, a lot of people tear the muscle in their buttock because they're in so much pain from their spine that they actually bend over and pick things up improperly. Now this woman, just because she's had back pain, she hasn't stopped living life. She wants to have a full life, and she's a hard worker. So she's here with her husband to get fixed so she can go back to living a normal life. That's our goal here with her, okay? And one of the things we need to do is get rid of the buttock pain on both sides. And that's what we're doing by releasing the piriformis muscle. Shot. I think we're done on the left. I felt the muscle go. You can actually see the shadow of the muscle there. Jordan will show it to you. But that's it. We're done on the left. Pressure, please. Pressure. Come on. Thanks. Any questions about the release so far?
No current questions, but we do have a comment coming from the Classic Carnut once more on YouTube.
I appreciate you being here, Classic Carnut. Before we do the comment from Classic Carnut, I just want you guys to know. Actually, Jordan, let's pull out for a moment. I'm going to show them where this muscle is so they can see it. I'm going to draw it for you. All right. So I'm going to show you that this is the butt. This is the top of the butt crack right there. Okay. We've already done the SI joint. This is our SI joint Duke plasma rhizotomy incision here and here, both sides. Then we had the facet joints. So this is Duke plasma rhizotomy for facet joints, both sides. Okay, so there and there. Then we had the Duke laser disc repair earlier. All right, we did that at 045 on both sides, and that's that one plus this one. Okay, now we're doing the piriformis releases. So the piriformis muscle attaches right here to the tailbone, and it runs right over to the top of the hip, called the greater trochanter, and attaches to the greater trochanter. This is the safest place to cut the muscles, tendon, and relax the muscle, because she has a tear in the middle, and the sciatic nerve runs right through the tear, causing leg symptoms, but also horrible pain in the top of her butt. When I pushed right here in the clinic, she said, it hurts so bad. So I diagnosed her with piriformis syndrome. Now she's in Canada. She doesn't want to have to come back and do another visit. So we just got it all done in one day. The last thing we're doing after we release the right piriformis is we're going to restart the stream one more time. We're going to go in and open her back up and take her screws out on the right side at S1, because that screw is pinching her nerve. All right, bring in the fluoro, and I'll take the question.
This comment coming from Classic Car Nut once more on YouTube, just saying thanks again. Just following up on their leg question. Thanks again. One thing MRI shows from 2023 shows L4 to L5 fissure at the 6 o'clock position.
Yeah, so L4-5 fissure at 6 o'clock is very unlikely to be the cause of your leg pain, but it could be. The best thing you can do, if I haven't already done a telemed with you, you need to fill out the form online and get your free MRI review. Otherwise, you're just guessing. We're just guessing, and guessing is not how I operate. I don't work on people by guessing. I know exactly where their symptoms are coming from before I choose to operate. Shot. Okay, are we internally rotated?
Yes, sir. Mm-hmm.
Shot?
Yep.
All right, very good. So this looks pretty good right here. Num right there. We're going to make our incision for the right piriformis muscle release. Go ahead. Keep the questions coming. I'm happy to answer them as long as I can.
At this moment, no current questions.
All right, Henry. We're going to be done with this in about 5 minutes max. And then we're going to move on to the open surgery, where we're going to slice open the back. We're going to remove the screws.
Copy that.
At L5. On the right side. Oh yeah, I feel that piriformis muscle. It is twanging. She's got a very bad tear, and the muscle is spasming pretty bad. All right, let's see where we are. Shot. We use the X-ray to guide the release. Beautiful. That's the highest point of where we want to be. She's going to do very well with this surgery. I'm very excited for her. By the way, this procedure again is another one that we're patenting. Shot. I developed it, first in the world to do it, and it's minimally invasive piriformis muscle release. The piriformis muscle releases that have been done to date are open and they're endoscopic. Those are the two types. Open is extremely painful, dangerous, and rarely works. But the endoscopic is pretty good. All right, that should do it. Folks, we are done. Any questions?
No current questions.
All right, we are going to next open the backup, and we'll start a stream in just a moment for that. We're going to remove the hardware, okay? So come on back to the last stream on this patient.